Welcome to the Eureka Springs Hospital Commission meeting June 16th, 2025. Roll call, please.
David Carlisle, Commissioner.
Kate Dreyer, Secretary.
Brian Byler, Vice Chair.
Sandy Martin, Chair. Vivian?
Vivian Smith, Commissioner.
Cynthia Asbury, CFO.
Lana Mills, Nursing.
Okay, thank you all. I think you all got a copy of the minutes from our May 19th meeting. If not, there's a copy that provided. I'll entertain a motion to approve the minutes of May 19th.
So moved.
Second.
All in favor?
Aye.
Thank you. And approval of today's agenda. Do I have a motion to approve or any additions or changes?
So move.
I second.
All in favor?
Aye.
There is no public, so no public comments. Jody is at a family funeral and unable to be with us, but she did provide me with a report. First of all, the state trauma survey went very well. We received a few deficiencies that we expected to receive from lack of documentation from the previous administration. The plan of correction has already been submitted. And I want to thank Lana for her help with Velvet with that on that. It came pretty quickly. They were in and out in one day, right? That's great. On June 9th, the hospital had our first community education class on Stop the Bleed, and it went great. She said Velvet is an amazing teacher, and our next, she didn't finish this, our next community education class will be, and she didn't finish it. Do you know when and what it is?
I do not know. There was
Okay.
discussion of it, but I don't know what the topic ended up being. So.
Okay, great. Cynthia, financial report.
So in the financial packet, the first page is the cover sheet. Next page is bank account balances. We did have a decrease of about $384,000 for the month of May compared to April's. And some of that, I mean, I'll attribute to with our lower census and our billing out with the claims and reimbursement. I mean, that money flow kind of falls about 15 to 20 days after a claim's submitted. So, I mean, we had a lower census, March and April, which then impacted the amount of money that would be deposited into May. So the next page is our revenue by cost center. Looking at for the month of May, we were a total of over $814,000 billable revenue for the month of May.
That's fantastic.
That is even higher than what we were last year, last May. And within last May's, we still had surgery and PT billable revenue. So we more than exceeded where we were this time frame last year. So
That's fantastic. And that none of this includes the RAH money.
correct. That is just straight billable revenue. So yes.
And that's total charged amount.
But
That's
yes.
That's not what we get.
Correct. That is our total billed revenue out. Yes.
Fantastic.
Next page is our income statement for the month of May. I will see that you can look on the outpatient revenue, the amount there does vary a little bit from the billed services. Some of that is timing. Income statement is on transaction date, where the revenue is on service date, which service date captures everything that was truly patient care that was provided in the month, where the income statement had some transactions that hit into the first week of June, but they were for patient accounts that were seen in May, if that makes sense. So it's that transaction date difference in those two. But I mean, everything else is in line. I mean, continuing to work on our expenses. We have, cut where we can and what we feel we can at this time. Looking to continue to increase outpatient service options. Working on some cost benefit analysis, hopefully get those, first part of July to have some of those for some different areas and service lines done. But we did have a profit for the end of the month of a little over 200,000 for the month of May. So
That's great. Versus 62,000 the year
last year,
before.
correct.
That's great. And purchase services are way down.
Correct.
Which is nice to see. Is that because we've taken care of more of our lump sum?
Some of that and
expenditures?
some of the purchase services, what hit into that before, we have allocated correctly into the departments, but some of it is because of contracts that were reduced. So we've I mean, within that, I think the purchase services from last year, so I mean, had some of the invoices and some of the transactions into that. So we can look at the fine details on that if you want, so.
Excellent, excellent.
But yeah, I mean, our expenses are definitely down, I mean, even compared, so I mean, it's,
Yeah, substantially.
Our net revenue is higher than last year to date, and patient
Yeah.
revenue is darn close,
yeah,
797 to 808.
correct, yeah. I mean, they're very.
That's great. That's great.
And then I would just like to address a false statement made by one of the city council members at their last meeting, who asserted that most of the visits to the hospital are from tourists and not from the local community. I've attached a graph here. It has the same information, one in a bar and one in a pie chart, whatever your preference. The administration and the hospital commission understand the critical importance of our hospital, not only to the residents of Eureka Springs, the surrounding community, but also to the tourists who visit our beautiful city. The significant role of tourism and its impact to the hospital's census and financials have been a central topic of discussion for over the past 2 years. While we certainly observe an increase in visits during peak event weekends, it is important to clarify that the local community we serve compromises the significant majority of all the visits to the hospital. The hospital commission, the administration, and our dedicated staff are fully committed to ensuring the hospital flourishes and continues to provide essential care to everyone in our community, residents and visitors alike. So in this, I broke out, so you can see from just our ER visits, over 85% of our visits was local for the month of May. So,
That's great. That's great. Thank you for doing that.
you're welcome.
And again, I think it's important in somewhere we have a map to remind people of our service area, because we are like the only hospital within, I think the population figure is 57,000, with northern Missouri and Madison County.
So it's very
So
northern. Yeah.
this kind of reflects it with Missouri,
Yes.
you know, as well on it. So
Yes.
it's a great chart. Thank you.
That's,
Yeah.
that's incredible. It's kind of shocking to me, the small numbers of, as far as the tourist side of it.
Yeah.
You know, that's incredible.
And of course we do, but it's not just,
Sure.
you know,
It's not the significant, I mean, it's
we are a tourist town, but we are a resident
Right, yeah.
correct.
as well. Yeah.
And we continue
I would-
to work with the community, so.
I'd sure like to see us do this like you've done here in these next few
Yeah,
months. Love to
absolutely.
track this on a regular basis so we see it. I think it's fantastic.
Yes,
Be great.
Would it be of value to break it out by counties in our state?
Might,
Just
might.
curious.
We can look at it. We can look at it.
See how many we're getting from Madison County and see, you know, if we're pulling from,
That's great.
I mean, it pulled, I mean, most of them, yeah. I mean, there was only a few of those within the state of Arkansas was even,
Well-
you know, would have been, say, like a hot spring, so it was a tourist kind of up here, but most of them were all in our thing, and I mean, I can give you exactly the
Yeah,
final
the-
within the zip codes,
I
kind
was
of,
just
is what we
thinking
looked
of-
at.
more than anything,
Stations outside.
Yeah.
right,
Yeah.
more than anything looking at are these tourists in that 81%, is that still quite a few Arkansas tourists that come to town? So it would be nice to kind of see Madison County, just kind of see where they, you know, where they're coming from. If it's, gives us a little better idea.
There was only a handful of them for them that were Arkansas addresses that would have been tourists from out of town. I think the number was between 3 to 5 of those visits were only. So,
Okay.
I mean, they were absolutely local, so.
Great
I-
information.
I say only one thing about that, with the negative commentary of the papers, the fact that, you know, some of those people, even outside of our little local area, have seen the news or heard about the news of the hospital. So therefore, it still reflects that they're still positive about coming to our facility and using it, you know?
No, absolutely. And on that, I mean, we do patient satisfaction surveys, and I mean, every one of them have nothing but positive comments. They're thankful for the quality patient care they receive through our ER, competent physicians, competent staff. I mean, you know, family members who are thankful that we were there to take care of their loved one. They've complimented the, you know, changes within the internal infrastructure, like within the ER and, you know, cleaning things up in the carts, or just simple things like that, that just makes it look more appealing and more like an ER, so.
Good. Thank you for that. That's awesome.
You're welcome.
Any other questions for Cynthia? Thank you. Anna, CNO report.
As of last week, I finished the APIC courses for infection prevention that whenever the state came back in January and February, they assigned the task of infection prevention to me. And so we enrolled in APIC courses, and there were 2 different courses online that I had to complete, each having between 19 and 20 chapters each. So I completed those within the last 2 weeks.
Good.
And then again, the state was on site June 4th for the trauma survey. It did go well. We will have word on that, the final word, within 4 weeks. And the only issues were again from 23 and 24 as we expected and as Velvet spoke on previously.
Great.
And they did find no deficiencies in our current restructured trauma
Good. I was going to ask that question. So it was just all
previous.
the past that we couldn't produce.
Yeah,
Correct.
that we could not do anything about. But no problems with our restructured.
Super.
The ED numbers are continuing to rise. In April, we had 139 ER patients, May 207, and in the first 15 days of June, we've seen 105.
How many?
105
Wow, okay.
through last night at midnight.
Good.
We celebrated EMS week last month, at the end of the month, and we cooked out for all of the local EMS. And we also fed our hospital employees at the same time, and then any of our leftover foods we donated to a local, was it Cup of Love?
Yeah.
Yeah.
Couple of.
Cup of Love, we took that food and donated it, whatever we had left over.
Great. Super. Any comments or questions for Lana? Good work.
Yep.
Good work. Yeah.
Yeah. And getting that course done in number of pages or chapters, I guess, was, yeah. Beside your other work, that was pretty good.
Next on the agenda is mobile response van, excuse me. We've talked a lot about our issue with EMS and non-emergency transport that our EMS can't do. They understand now that we have to call them and report it. They didn't understand that before. They were a little, I think, agitated, but I explained that we had to call. Excuse me. So we got that all cleared up, but we still have the issue with transporting non-emergency. I did some research, and there are non-emergency transport vans, but they also go a little bit more on steroids, that we can actually get a mobile response van that serves as a non-emergency transport, but also a mobile clinic that allows us to go out into the community. I spoke to, the company I talked to is a Van Mobile. They're out of North Dakota. And I had a conference call with him last week. He's going to get me by tomorrow. I was hoping today, but he couldn't quite get it together. Cost and everything that goes through. Slick thing about this, it's registered as a cargo van, so there's no additional special insurance. Also, it doesn't require anything but a regular driver's license. Excuse me. Pardon me. I shared the information with Jody, and I think she shared it with you guys and Bill, but it's a pretty slick little operation. Handicap accessible, you can equip it a variety of different ways, bed, cot, whatever. In the mobile response van, there is cabinet space. You can add any kind of equipment you want to on it. So it looks like it's going to be around $200,000 to $225,000. There is a community grant through the Arkansas Economic Development Commission that is due the end of July. We have to apply through it through the city for it. Butch has approved it. He's already working on. They need a certified letter saying, from the city saying they agree with this. Also a resolution, and that's in the works with City Council to get that done this month at their next meeting, rather. If we don't get the grant, and I called the EDC and said, does this qualify? They said, yes, it does. So, but if we don't, Van Mobile also has a lease arrangement. That could be a straight-out lease or a lease to purchase, whichever one we want. So we also ran it by Chief Inman. He said this is a perfect solution. This would be great. Quite frankly, it could help him out as well.
Absolutely.
So he said whatever he can do, if there's anything with EMS as far as getting it cleared through there or anything like that, he'd be more than willing to help us with that. So it looks like it would be a good solution to a problem that we've been struggling with for years. And, you know, cheaper in the long run, I think. On the average, when we use Southern or one of the others, what does that usually cost us?
We don't typically, I mean, if they come out, they usually have a physician-signed certification statement, which deems the medical necessity of the transport, so they're able to bill the patient's insurance, so.
You never see it then, really? It doesn't come through your system?
No, rarely, I mean, even like Good Shepherd does transports sometimes for the non-emergency. I mean, and those, I mean, sometimes, I mean, will cost a couple $100 to the patient. I mean, we at facility level have paid for a few of those just because we knew the patient needed to somewhere else, so.
Okay. So what do you guys think about that?
Well, utilization of a dual-purpose unit. So we would send it out on some kind of defined mission where it sits in a place and the public comes in and gets a service. And so if we need to transport during that time, what's the resolution of demands for use of the van? They would just have to wait until whatever the 4 hours of its being on a certain
I
location.
think it'd be real similar to our transports now, that,
You wait
know,
until it
you have to
comes.
wait till someone's available, right? So, I mean, we could still be flexible, I think, with it, but we, you know, if we're, I talked to a Lifeline nurse
Yeah.
that I'm doing some work for, and she worked for Eureka years ago, but she said, you talk about a powerful piece of equipment to bring into the game as far as being able to reach the community and also meet our transport need. She said it's an excellent idea. Everything she's heard about it is very positive, very positive. And she's a Lifeline nurse that's been doing that for quite a while. So she's more than just our community. But she thinks it's a win-win deal to get involved in that side of it. My question is, with CMS, the same thing falling under our grant program, I was thinking of even the Quorum Court. Since we serve Western District of Carroll County, there's no reason why we can't even reach into the eastern part of Carroll County with that kind of a van for a clinical, you know, type of thing. We go out and do park it somewhere in that. And I know she mentioned to me the fact, like, if someone had been released from the hospital, you know, under their observation, but been released and sent home, or even had gone to Mercy maybe and they came back, you know, into Rogers, or that we could go out and do service on that person or help that person from that van, you know, that clinical
Absolutely.
thing, to people that have been seen recently. And I thought it just had great possibilities. And
We would not be restricted by any geography as far as where, you know, we can go. And
with Madison County not having a hospital anymore, there's a perfect example there of a need. You know, with what they're getting swamped with on their ambulatory side of it is incredible. So, if we're able to even reach into the Madison County area in the future or whatever, but
yeah. Well, and I think the Holiday Island
Yeah,
as well.
absolutely,
They don't have it.
absolutely.
Lake. They don't have it
Right.
either.
And
You know, they've got Rogers or us.
we've got so many people that are out there that maybe don't have the ability to be transported or get transportation to go to the hospital, or, you know, even though it's a non-emergency, or go to, you know, then we open up the possibility of that door too. It's something we have to look at.
But we'll have to set, you know, you guys will have to set policy for it, like, you know, it's not necessarily taking somebody to the doctor, you
Right,
know.
right.
But, you know, it is for emergency, but, you know, I trust you guys will
yeah.
work out the policy on that, so,
Yeah,
yeah,
and we'll have to just look at the CMS billing guidelines and regulations on that as well, but.
right.
And you know, yeah, and of course not jumping. If we need EMS there with paramedic, we know we're.
Yeah. So I think because it is a grant type thing, I'd like to entertain a motion to proceed with the grant and/or purchase or rent
Right.
of a mobile response van.
I so move on that motion.
I'll second it.
Okay. Any
Kate, any
objections?
questions or?
No, not yet, thank you.
Okay, Vivian, any questions?
No, I think it's a great community benefit. I'd go with it.
Okay, all those in favor?
Aye.
Aye.
Opposed? None heard? We'll proceed with that. Okay, I'll entertain a motion to go into executive session to discuss hiring a CEO.
So moved.
Second.
All in favor?
Aye.
Aye.
Okay, we are now in executive session.
Yeah,
Oh, so
we're good now.
do I have a motion to conclude executive session and resume regular commission meeting?
I so move.
Have a second?
Second.
All in favor?
Aye.
Okay, we'll resume the regular commission meeting, and I will entertain a motion as a result of our action in executive committee.
I propose we make an offer of employment to Tiffany Means with a salary of $230,000 a year and a to-be negotiated incentive bonus plan.
Do I have a second?
I second it.
Okay. Any opposed? Hearing none. All in favor?
Aye.
Aye.
Vivian? Okay. Whoa. Sorry. Okay, thank you very much. And she has accepted, Tiffany Means has accepted our conditional employment offer. She will be here Friday at the hospital at 1 o'clock. I will speak to her this afternoon and we'll set a schedule. She'll be at the hospital first. Hopefully we can do a community meet and greet, maybe, depending on how much she has there. And then meeting with the mayor as well. So we're excited about that, and I'm glad this is a done deal. I think we've got a good stuff. Start date also will be August 1st.
August 1st.
There's
Uh-huh.
been some talk about having Bubba's maybe pay
Oh, yeah?
her teachers or something. Yeah, reach out to Cynthia.
Okay.
I think she was around Memphis. Sent that to the farm.
Okay.
Have it down in the basement.
Yeah, we might have it over at the clinic just so we don't have issues going through the hospital.
That's very true, what they talked about.
Yeah, yeah, no problem. But I'll confirm that with everybody after I talk to Tiffany and make sure she'll give us the whole afternoon and evening. That'll be good. She will also be back in town in July as well, so superb. Okay, thank you. Good news all around. CEO, good financials, good trauma survey. It's looking good. Budget workshop, just real quickly, we had a budget workshop. We will continue every month to do budget workshops. We'll start on 2026 in September, and that will be part of what Tiffany will do with Cynthia. And I think the budget workshop went well. I think we had a lot of good discussion, and administrative has kind of identified ways, and you're looking at cost cutting, and now we've got to put the revenue generating and the additional services in.
Yeah.
That's it on that. Commissioner comments? Vivian, let's start with you, since I always forget you.
Yes, I have nothing further to add, Sandy, all good news.
Good. Thank you. Kate?
Great job on the trauma survey, one and all.
Brian?
Just, it's a yah day.
So,
Great job, ladies, so everybody.
David?
I'm glad to see us moving towards a stable position.
Yeah.
And really appreciative of the current administration's efforts in that regard to have us back with a positive balance for this first month.
Absolutely. I can't say any more than what I've already said. I mean, the staff got us to this point. You, Jody, Velva, everybody, Dr. Roberts. I mean, it feels so good with the staff that we've got, we're putting together. And I think Tiffany in the leadership role is going to be pretty dynamic. So I'm excited about it and looking forward to it. Last thing I have is we had the workshop with City Council. We had Bo Royale, who is President and CEO of the Arkansas Hospital Association, provided great information in a presentation. If anybody out in the public wants one, please contact me, and we'll be glad to send you his updated information. It was very informative. We have issues that we need to keep watching, close watch on Medicaid and Medicare, obviously, because it will impact us. So with that, I'll entertain a motion. But first, a reminder that our next workshop is July 7th, 2 o'clock at the Odd. And the next regular meeting is July 21st, 2 o'clock at the Odd. And with that, I'll entertain a motion to adjourn.
So moved.
Okay.
Second?
Second?
I second.
All in favor?
Aye.
Aye.
Thank you. Thank you very much. Thanks, Kate. Thanks, Vivian.